Okay. Hello, everybody, and welcome to our session today on what you can do to address health literacy. My name is Elizabeth Brewer, and I'm the Director of Research and Care Transformation at Kootenai Health. I am also the co-chair of Caregiver Wellbeing and our Compassion Committee, which is focused on patient experience. So this is an important topic for our patients to make sure that they have the best experience in their care. And today I'm joined by my colleague, Julie, who will introduce herself.
Hi, everybody. My name is Julie. I'm the patient engagement specialist here at Kootenai Health. And one of the things that I do is communicate with our caregivers about health literacy. It's something that I'm really passionate about. So I'm excited to be able to tell you a little bit more about it today.
All right, we're going to go ahead and get started with a story. First, our objectives for today. We're going to define health literacy and its impact on patient outcomes, and then identify some strategies that you can take to address and combat low health literacy. And at the end of this session, there will be an assessment that you can use for your credit. So, our story today is about Bob. This is Bob here in the picture. He's 82 and he is a retired college professor. So Bob was recently discharged from the hospital with a new diagnosis of heart failure. And he's in the clinic today for a follow-up visit. His wife is under the weather, so he's here today by himself. And as you review his medications with him and the hospital discharge instructions, he reports that he's been following his instructions carefully, but is not feeling much better. In fact, maybe feeling worse. So he tells you that the discharge nurse at the hospital told him to rest for the first 4 to 6 weeks. And so he's been lying on the couch during the day and only gets up to go to the bathroom. His instructions said to stop smoking, and he reports that he's switched to chewing tobacco instead. He's been avoiding potato chips, which are his favorite snack, because he was told to avoid salty foods, and he's trying to eat healthier. So his wife has actually been preparing him canned soup for his lunches instead. He was prescribed a bunch of new pills when he was discharged, but has since stopped taking them all because they make him have to go to the bathroom way too much, so he can't rest like the doctor told him to. Bob has low health literacy. But how can that be? So Bob is a highly educated man. Remember, he's a retired college professor, but how could somebody like that have low health literacy? Well, he's not alone. A national study on adult health literacy showed that only 3% of older adults are proficient in health literacy skills. And in our overall population in America, it's estimated that 90 million Americans have low health literacy. And looking at the statistic here on the screen, you can see 99% of Americans can read, but only 12% are what we would call truly health literate. So what is health literacy and what do we mean by that? Because it can mean different things to different people. We're going to use this definition of personal health literacy from the Healthy People 2030 study. And in this definition, it says that health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform their health-related decisions and actions for themselves. And this is good to use as a personal definition, but as healthcare providers, we also need to look at what we mean as an organization as well. And so as an organization, it's the degree to which we equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So health literacy does not necessarily have anything to do with your education level. And I consider myself, like Bob, to be fairly educated and somebody who even works in the healthcare profession. And yet I was at a recent healthcare visit where I had to say, stop, time out. I don't understand what you're saying. So it's really a discrepancy between the information that you need and the information you can understand and the way it's presented to you. So taking into account something as simple as getting a new medication from the pharmacy. So healthcare is very complex. So first, to get a new prescription, you have to fill the prescription. Then you have to be able to read the pill bottle, know what the medication name is and what it's used for. What if it says something like take on an empty stomach? Do you understand that that means that you haven't eaten for 2 hours before you take the medication and that you aren't going to eat for another 2 hours after that? What if it says don't drive while taking or may cause dizziness? There are probably other things that you need to be aware of as well. And if it says to take it twice a day, does that mean you can take it at 10 a.m. and then again at noon? Or what does that mean? How do you get refills? What if you miss a dose? There are so many different things just in this simple act of taking a medication that it's no wonder that people have low health literacy when there is so much information to really truly understand. So what does low health literacy really look like? We're going to watch a video from the American Medical Association. This video has real patients with real examples of how they experienced low health literacy and the impact that it had on their lives. And so as you watch this video, it's about 5 minutes. I want you to think about patients that you know or situations that you may have personally been in that are similar to this and the impacts it may have had. All right.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess the doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know what this is.
Twice?
Twice daily.
Okay.
Okay.
So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered?
Mm-hmm.
Hypered?
Like you're hyper?
Mm-hmm.
What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, Okay.
But you know you have high blood pressure.
Mm-hmm.
Okay, but hypertension doesn't mean the same to you.
Mm-hmm.
So if I ask you if you have hypertension, you're going to just think I think you're jumping around on a chair or something like that, something different.
Just being hypered,
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
Most people have no clue that in 2023, the best way to
Tried to get it. Okay, so while you were watching that video, did you see anybody who reminded you of patients that you may work with, or situations that you may have been in? I know I've been presented with lots and lots of paperwork at a visit and felt pressured for time. So, there are not even necessarily educational or reading level issues there, but just the way the system works in some instances. So, what we're going to talk about is now the impact that that has on our patients, and a little bit more about how that feels for them. So patients with low health literacy, according to the CDC, are more likely to visit an emergency room, have more hospital stays, are less likely to follow treatment plans, and have higher mortality rates. So when we think about the emergency room visits and the hospital stays, if those were things that were unnecessary, really, or could have been prevented, those patients are really utilizing services that are not needed and are precious resources in a lot of ways. When we think about patients less likely to follow treatment plans, how often have we thought to ourselves, this patient is non-compliant? When we use phrases like non-compliant, it really puts a lot of the onus and the almost accusatory nature towards the patient, and that it's a choice that they're making. And maybe sometimes that's true, but maybe sometimes it's because they can't or because they don't know how. And it's perhaps better to say something like patient is not adhering to their treatment plan. Takes a little bit of the accusatory nature out of that. Remember, patients are very, very able to get and access the things that we type in their medical record these days. It's very public and easily available to them in a lot of ways. So it's important to be cognizant of the words that we use there. And patients have higher mortality rates. There was a study about heart failure patients that they had a 12% higher mortality rate. That's not insignificant. So lower utilization of preventive care and services, difficulty understanding medication instructions, and all of this together intersect as well. So more likely to have a hospital stay, which means that they're going to have probably more medications prescribed to them, which just escalates and creates this cycle. Health literacy here in North Idaho is fairly similar to the rest of the nation. So when you look at this map here, you see a picture of the United States, the 48, and the red and the dark red, or orange trending to dark red, are those the highest percent of basic or below basic health literacy. And the green are the counties with the lowest percent of basic or below basic health literacy. So when we look at our sort of geographical region here in the Panhandle, the 10 northern counties of Idaho, you can see right here in the middle, Kootenai County is actually light green and dark green, so on the higher percentage. But when you include our bigger geographic area where all of the patients that we serve come from. We are actually about 35% at a basic or below basic health literacy level, which is right on line with the rest of the nation. So this is very similar to what you'll find across the country. So some myths about health literacy. Patients who nod yes understand what you are telling them. And I think we saw some of these in the video where the patients themselves told us this is not true. Yes or a nod, maybe just acknowledgement that they heard you, not necessarily what you said made any sense, or a nod to just keep going with the conversation. Substituting plain language for medical jargon is insulting to well-educated persons. That's not true either. For the most part, using plain language is always going to get you a better result. The number of years of education is a good indicator of one's health literacy. Again, we discussed that at the beginning with our story. Bob is a well-educated college professor, but has low health literacy. So education is not necessarily a good indicator for health literacy level. All persons with low health literacy skills are uneducated and can't read or write. So this is like the opposite of the one before. Patients with low health literacy skills, it may or may not have anything to do with their education or their ability to read or write. My patient will tell me if he or she can't read. You saw that example again in the video, the lady who got all of those papers presented to her, who really struggled with reading. She didn't want to say that. She didn't want that stigma or that shame of not being able to read or to read well. So she didn't say anything and had a hysterectomy. I'll be able to tell if my patient can't read the info I provide. I would say no, that you cannot. Patients who can't read are very well adapted at not letting people know that. They have lots of coping mechanisms. They might say something like, oh, I left my glasses at home. Can you wait till my wife gets in? Or may just want to hurry it along and agree and want to sign it right away. It's very difficult in many cases to know if somebody cannot read. Okay, so here's an example, and we want you to try out how health literacy or low health literacy may feel. We're going to show you a paragraph, and I want you to read it and try to understand what is being said. So just take a moment or two and read through this paragraph. You can go ahead and pause the presentation if you need extra time. Did you get it read, Julie?
Every word.
So how did that feel? Do you know what that passage is about? Any ideas? Do you know what the first step you need to do is? How about what do you need to check for? If we go back, these words, some of them are written forwards and some backwards to give you a sense of how difficult it can be to decipher when you have low health literacy. But this is about injecting insulin. So drawing up the required number of units of air into the syringe by pulling the plunger back. That's the first step. What do you need to check for? You need to check the syringe for air bubbles. That's about the third line from the bottom. But how easy was that to read or to decipher? Not very at all. And that's what it can feel like when you have low health literacy. So some differences between low or high literacy readers. And again, these are things that you may or may not be able to pick up on, but certainly if you do see them, it's something to be aware of. So low literacy will read slowly, sound out words, read word for word, and have trouble finding meaning. Those with higher literacy are going to read quickly. They'll read words and sentences with ease, and they're going to read for meaning. Some other red flags for people that may have limited health literacy, they will wait to seek help until an illness is advanced. So, sometimes that really frustrates us as caregivers that, man, why did this person wait so long to come in? If we had just seen them sooner, we could have caught this sooner. And this is one of the results of having lower health literacy. They may act angry and demanding, and sometimes that can come from a sense of embarrassment or shame.
Trying to cover.
Mhm. Or on the opposite, they might be quiet and passive, just trying to get through without having to have any significant interactions or not asking questions just so they can move on. They may skip tests, don't follow up on referrals because they don't understand that they have referrals, that they have tests, what the tests are for, why they're taking the tests, why they need a referral, what benefit that is to them. They may make excuses for not completing health forms, such as we just talked about. They might say, oh, I didn't bring my glasses with me today, or they might not do them at all. They may miss office visits, might have trouble discussing their health concerns, hard to find a way to put it into words, or have trouble listing their medications or explaining how that they take them. Now, be aware that even though these are common red flags for limited health literacy, they're also red flags for a lot of other things. So you can't always assume that somebody acting angry and demanding has limited health literacy, or that people who miss office visits have limited health literacy. But all of these things taken together might clue you into something. And really the best way to address health literacy in general is what Julie is going to talk about in a little bit, and using universal precautions. So finally, in the clinic environment where many of you work, how does low health literacy affect that environment? Well, it may result in you seeing increased phone calls, lots of questions coming in about things that are misunderstood. You may see canceled appointments, patient dissatisfaction, certainly if they are unable to understand their healthcare, that definitely leads to dissatisfaction, and decreased patient safety. And at the end of the day, we're all really here for our patients, and we want to make sure that they're getting the care that they need. And so understanding and addressing how you can help with low health literacy is really important. So this is impactful not only to your patients and to you, but really to our population as a whole. And so Julie is going to share now some things that we can do about it.
So you probably understand from looking at that video and the things that Elizabeth has talked about that there's a fair amount of shame that goes along with having low health literacy. Nobody wants to admit that they don't understand. And if you think about, Elizabeth shared an example of her, and I have a very similar example from a while ago, and where I had a cancer diagnosis, and I went to the oncologist, and I remember the nurse in the oncology office, as we were talking about this new diagnosis, saying, oh, you're a nurse, you know all of this. And actually I didn't, but I was too embarrassed to say that I didn't understand that. And so there are some things that we can do with every single patient we encounter that can help kind of cut down or eliminate some of those gaps that allow patients to not fully understand what their healthcare instructions or their treatment plan is. So here's a few best practices. I'm going to toss these out for you, and then we're going to simplify it. But the first one is to create a shame-free environment. So again, as I said, there's a lot of embarrassment that goes along with this. So find a way to help that patient to not be embarrassed. One of the ways you can do that is by, as you're talking to people about things, instead of saying things like, do you have any questions or things like that, is to say, at this point in time in this conversation, a lot of times patients have some questions that they want to have answered. And so I'm wondering if you have some questions that I could answer for you. So you're allowing that to be, oh, this is how everybody is. It's not just me being embarrassed because I'm dumb and I don't know what you're talking about. So that can be really helpful. Take it slow. So if you're a fast talker like I am and like I am doing now, that is not helpful for a patient who's trying to take in all of this strange information and process it. So take some pauses along the way, stop, allow them a chance to be able to ask questions and then continue on.
Julie, I think you've mentioned before that even for people that have a higher degree of health literacy, depending on the situation, it may be lower. Like if they're in a high stress environment.
Absolutely.
And that's when this take it slow is really important.
Yeah. So, and we all have kind of varying degrees of health literacy along the way. So I may, in a certain situation in my preventative visit, where I'm relaxed and I'm not expecting anything bad to happen, I may actually have decent health literacy. But if you give me a cancer diagnosis where I'm not sure if I'm going to live or die, and I go to the office to have that explained to me, I'm not going to be processing information as well. And remember that definition Elizabeth shared with you at the beginning, that the health literacy has a lot of components and reading is just one of them. But it's the ability to be able to take in, read, understand, process, and then take action on the information that you're given. So lots of different variables that can be impacted along the way. So take it slow is pretty important. Whenever you give patients instructions, try to give it to them in 2 different forms so that patients have the ability, if they process information differently, they can hopefully get it in a way that's helpful for them. So always try to, if you're going to tell a patient something, follow it up with some writing as well. And we're going to talk about written materials here in just a little bit. If English is not your patient's first language, even if they are fairly proficient in speaking English, consider having an interpreter there. As Elizabeth just mentioned, when you're in a fairly high stress environment, it's hard sometimes to process things in a different language, even if it's one that you are accustomed to speaking. So having an interpreter can be very, very helpful, whether it be an interpreter on the phone or whether it be some other method. We do try not to have family members interpret because there are many cultural implications with having family members interpret that sometimes can skew the information and it may not be as accurate as it needs to be. Always make sure that there's a support person there if you're going to be giving or if somebody's going to be delivering significant information. I am my husband's support person. He is a college educated guy, but when you put him in a healthcare environment, his eyes kind of get all googly and it's hard for him to kind of take all of it in at one time. So I go as a support person and then I can help interpret what we heard afterwards. So that's always very important. And then give information in small bits. So 1 to 3 small concepts or chunks at a time. And we struggle with this in a hospital environment a lot when we discharge patients because we have a limited amount of time and a lot of things that we feel like we need to, kind of throw up on the patient as far as their discharge instructions go. So we try to teach our staff that they should be starting patient education at the very beginning when they first get there and give it in little chunks along the way. And likewise, you can do that in your encounters as well with patients. And then also stay away from medical jargon. One of the things we love to do as healthcare providers, all of us, is use strange words that we are comfortable with, but others are not. And so to help to try to make it as understandable as possible for patients, we use something called living room language, or as Elizabeth referred to it earlier, plain language. So that is one of the best things you can do to help combat low health literacy is use simple, plain language. And then the other thing is to use something that we call teach back. Those 2 things alone, those are called the universal precautions of health literacy. So if we use those with every single patient, we're less likely to be giving information in a way that a patient does not understand. So what is plain language or living room language? Well, it's really things that a patient can understand the first time they hear it. So they call it living room language because it is like if you were sitting on the couch in your living room having a conversation with a friend who's not in healthcare with you, but that you might just be having a plain conversation. So I'm going to give you a few pieces of jargon, and in your head, kind of think how you could say this maybe in plain language instead that could be more useful for a patient. So the first one is myocardial infarction. If you think about another simpler way to say that, if you said heart attack, that would be a really good simple way to say it. How about the word exacerbate? We hear that all the time, like their COPD is exacerbated. Well, what if you just said, it's getting worse? That would be a very simple, plain language way. What about lesion? Well, maybe you just say a cut or a sore. How about pulmonologists? How many of you work for pulmonologists right now or refer to pulmonologists? Well, maybe you just call them a lung doctor. That's much simpler to understand than the jargon of pulmonologists. What about an adverse event? Well, let's just call that a bad reaction. And finally, how about a biopsy? Sending your patient for a biopsy, what is that? Well, how about if we just say, we're going to take a sample? Oops, I think I got another one or two here. Benign. So if we say your biopsy is benign, maybe instead we say the sample that we took was not harmful. It's not cancer. Be as specific as you can with your language. What about this one? Probably have said this a lot to patients. Your COVID test is positive. Well, what does positive mean? Is positive good? Is positive bad? What is it? So instead, you have COVID.
And now I've taken many COVID tests
Yeah.
and had been tested over the years, and I still have to read the definition every time to say, what does that mean? It's not detected.
Do I have it?
Do I have it or don't I have it? Yeah.
What does a patient want to know? They don't want to know if it's detected or not. They just want to know, do I have it? And what do I need to do then? Here's a statement that we could simplify. After you void, your abdomen will not be as distended. Well, to a patient, a void is a black hole. So what does void mean? Well, how about if you just say, once you pee or you go to the bathroom, your stomach is going to feel less swollen. So you can see how with those examples, we can just take that language that we use every day and turn it into a simpler, plain language for our patients. And this does take some practice. So the point about this is to really start thinking, try to think more in simple, plain language so that as you share it with your patients, that's what you start to use.
You know what I like about the plain language also is that it's more conversational, and it really creates, I think, a easier relationship with patients as well. It doesn't put a separator between you and the patient as I am the professional and you are the patient. There's no hierarchy because you're speaking the same language.
That is very, very true. And I have appreciated it, even as a nurse, I have appreciated it immensely when my providers use plain language. It's just so much easier to digest and understand. So a couple of other things that go along with that when you're having conversations with patients is also to be specific. So instead of speaking in generalizations like this statement here that says, follow bicycle safety precautions to prevent injury. Well, what does that mean? It could mean a lot of different things. So instead, be specific, then it doesn't leave anything to interpretation for the patient. So you might say, wear a helmet, use your hand signals when you are turning or stopping, ride in the bicycle lane. So be as specific as possible. And if you notice your provider being more general with things, it might be an opportunity for you to ask a question that allows the provider to be more specific in front of the patient, or to be able to help kind of make that more specific. And then the other thing is to think about trying to create a message that is positive and simple. So, if you tell a patient don't do something, what's the first thing they want to do is they want to do it, right? Nobody likes to be told don't do that. So instead, we think about ways that we might be able to say it that is essentially the same thing, but in a more positive format. So you wouldn't say something like, don't ride your bicycle without a helmet, or don't expose yourself to chemicals that can make you sick. You might say, wear your bicycle helmet every time you ride your bike, or stay healthy by staying away from chemicals. So it just makes the messaging just a little bit more positive. So just a brief word about written materials, because we all give our patients written materials, right? And I wonder if you've ever taken a look at those and just said, hey, is this easily understandable by all my patients? So if you are needing to create materials in your office, or just even give it a kind of any of the materials you give out, kind of the sniff test to see, but we're looking for an average of materials that are written at about a 5th to 8th grade reading level. I'm going to show you an example of how you could see the difference between those here in just a second. But a lot of times the materials that I see that we write in our clinics and in the hospital are often written at more about a 10th grade level. And that's pretty standard when people are writing those. And that's not understandable to a large portion of our audience. So we try to stick with, again, simple things, shorter sentences. So chop up concepts into short sentences. Try to use words that have less than 3 syllables so that they're easier to understand. When you're giving something out, make sure that it's not just crammed with writing and paragraphs, but try to make sure there's white space and that maybe things are written with bullets that are easier to read than lots of sentences. And then just make sure that you go through that information with the patient. Try not to just hand a patient something and go, here you go, here's some info about whatever you have. But, sit down with them and highlight words that are keywords that are important. And then we want to check for understanding before they go. And then you can also use simple pictures as well. Pictures are kind of fraught with some challenges sometimes. So, if you're talking about something that has to do with the lung, you would never just stick a lung on a page, but you really want to show the form of the person with where the lung is so that they can see that a little bit more simple. So here's an example of something that's written at a college level, so above 12th grade level. And so if you were to read this, you probably in this situation would be able to fairly understand it, but imagine you're a patient sitting in an office and you're given this. So if you were to simplify that to an 8th grade readability level, exact same statement, it's just now a little bit simpler. The words are a little bit simpler, less sentences. It's just distilled down in something a little easier. And then even further, if you go down, here it is in 4th grade. And so if you were to look at these, there's no words over 3 syllables. The sentences are very short. And these all mean the same thing. So you can see that with your what you give to patients, you can make it much more understandable if you're careful about how that material is written before you give it out. So we've talked about plain or simple language as one of the universal precautions of health literacy. And the next one is teach back. So 90%, this is from the government, from Health and Human Services, 9 out of every 10 patients don't have health information delivered to them in a way they can use or understand. In fact, there's a study that shows that about 40 to 80% of all information that a patient is given during a healthcare encounter is forgotten immediately. So let that sink in a minute. Up to 80% of the stuff that a patient is told in their encounter is out the door by the time they leave you. And of what they do remember, about half of it is inaccurate. So that doesn't leave a whole lot. That's part of the reason why it's important for us to make sure that everything is simple and that our patients understand it before they leave our presence. So let's talk a little bit about what teach back is. Teach back is a technique that we use to determine the patient's understanding. But what I will say is it is not a quiz of the knowledge that we've delivered to a patient. Remember, there's shame that's related with low health literacy. So we would never want to say to a patient, okay, what did I just tell you? What was that about? What did I tell you? Or what are you going to do if this or that? It really should be more about how we deliver that information to a patient. And so it's all really about us. If we put the responsibility on us and how we deliver the information, it takes that shame away from the patients and it allows them to be able to be more part of that conversation. So what you're going to be doing is asking patients to repeat in their own words what they, what it is that you've shared with them. And if their understanding is not quite what it was that you were giving to them, you want to go back and make sure that they do understand it before they leave. You don't want them to leave with any misunderstandings. So this is if you like algorithms, this is a little schematic about how you do it. Whenever you're providing information to a patient, we give it in little small bits, 2 or 3 small points at a time. And then we check for their understanding. And if there is a need, then we can go back and teach again if the understanding is not quite matching. Here's some examples of ways to use what we call teach back. The first is if you're teaching the patient a skill or somebody's teaching them how to do something, is to have them show you back again. But really, again, we put the responsibility on ourselves. I want to make sure I did a good job of explaining things clearly. So can you, explain it back to me to make sure that I did a good job of that? Another way to say it would be when you go home and you talk to your wife, like our gentleman at the very beginning, what are you going to tell her about what we talked about today? So that can help you to determine whether they understood that or not. And so we do that in little bits. So again, a couple chunks of information at a time rather than trying to give them everything and then say, what did I say and get it back. So if we do those two things, and also too, sorry, I just noticed I have open-ended questions at the bottom. We want to make sure that we are careful not to say, do you have any questions? Or do you understand this? Because those are closed-ended questions and they're very easy to say what I think you want to hear by saying yes or no. So instead, make sure that those are open-ended kinds of questions.
Easy way to do that is to say, what questions do you have?
Yes, exactly. What questions do you have? So just to kind of summarize where we are at the moment, both Elizabeth and I have kind of defined what low health literacy is, or health literacy in general, the impact of it, and how it can really affect patients, and actually how it can affect the healthcare system too. And then what can we do about it? And so just to summarize, really, it's fairly crucial that we recognize the importance of low health literacy and how it impacts patients, and their ability to be able to take care of themselves, because most healthcare is self-care. The times that we are encountering patients is such a small blip in their life, and all of the rest of their healthcare journey is self-care. So we want to make sure that they have the tools to be able to care for themselves outside of our offices and our clinics and our hospitals and that sort of stuff. And so with that, Teach Back is the thing that does that. So anything, Elizabeth, you want to add before we close?
No, Julie, great job. I love the
you.
examples.
Thank you. Now, what we did do at the end is we added a few, if you want more information, a few tools and things for you here. So there are some websites or things where you can actually get glossaries on how do you say a technical word in a different way. And so I put those on there. I also gave you some examples of ways that you can test how readable a document is to see where it is. And then a little bit of a toolkit on how to learn more about Teach Back. And then the last one is just a little bit of information on simple ways that you can educate patients. So one of the best patient education sites I've ever seen for simple patient education is Medline Plus. It's a government site, has lots of very simple patient education materials on it. So you can, capitalize on these if they'd be helpful for you to use in your clinics, or just kind of research so that you're learning a little bit more about these things yourself. And with that, I think we're done.
Yeah, thanks
so
everybody.
much.
Bye.
How long?